Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's March 19th, and we have a lot to talk about. MS is an equal opportunity neurological disease. It doesn't really seem to discriminate against any particular ethnic or racial group. It affects Latinos, African Americans, as well as Caucasians, and if you're an MS research scientist who's hoping to come out of a clinical trial with a viable treatment that's going to be safe and effective for the diverse population living with multiple sclerosis, then having that diversity represented in your clinical research seems like it would be important. Yet it doesn't always happen that way. As a matter of fact, it rarely happens that way. My guest on the podcast is Dr. Mitzi Joy Williams, a neurologist and MS specialist with a strong interest in better understanding the course of MS in ethnic minority populations and in increasing diversity in clinical research. But before we get to my conversation with Dr. Williams, there are a few other things that you should know about. The Department of Defense plays an active role in funding MS research, and that might be something that not everyone hears a lot about. But today, there are 70,000 U.S. military veterans living with MS. So in 1992, Congress established the Congressionally Directed Medical Research Program, or CDMRP. This medical research program is part of the Defense Department's budget, and it specifically funds high-risk, high-reward kinds of research projects. One of those projects attempted to identify a viable source of stem cells for transplantation and to better understand what actually occurred in the central nervous system once that stem cell transplantation had occurred. The lead investigator in this project was Dr. Stefano Placino from Cambridge University. Now, in previous research, Dr. Placino had already examined the role of neural stem cells in treating MS. Neural stem cells are so-called master cells that can develop into neurons and myelin-producing cells known as oligodendrocytes. Dr. Placino was able to harvest neural stem cells from a healthy adult brain, expand those stem cells in the laboratory, and transplant them into animal models of different central nervous system disorders, including MS. And that study showed that transplantation of adult neurostem cells into the mouse model of MS promoted remyelination and recovery of demyelinated neurons while reducing functional impairment. Well, to overcome the challenges associated with harvesting neural stem cells, Dr. Placino and his team created a method of inducing mouse and human skin cells into producing neural stem cells in the lab. They transplanted these lab-produced neurostem cells into mice with the mouse model of MS, and they observed the same positive outcome. There was a reduction in spinal cord demyelination and axon loss, and there was a clinical improvement in the mice who received the transplanted stem cells. Stem cell therapy is a topic of major interest among people who are affected by MS, and the results of this research study represent one more reason why. Now, obviously, there are vast differences between a human brain and a mouse brain, and that's why there's already work being done to extend this research to investigate what might be a potential path to remyelination. Now, if you'd like to read the details of this study, I'll include a link in today's show notes. And while we're talking about MS being diagnosed among military service veterans, I also want to mention that about 2 weeks ago, the National MS Society entered into a strategic partnership with the U.S. Department of Veteran Affairs. Now, these strategic partnerships serve to accelerate the MS Society's impact, and this newly announced partnership with the Department of Veteran Affairs is going to ensure access to services and support for the 70,000 U.S. military veterans who are living with MS. And accelerating delivery and ensuring access to services and support for the men and women who have served our country is a very good thing. And this newly announced strategic partnership, well, that represents some very good news. This is probably a perfect follow-up to the news we just discussed about stem cell therapy. A couple of weeks ago, I attended the ACTRIMS Forum in Dallas, Texas. Now, ACTRIMS is the America's Committee for Treatment and Research in Multiple Sclerosis. It's one of the major MS research conferences in the United States, and this year, it brought together 1,100 MS researchers and clinicians. One of the studies presented during the conference was conducted by Dr. Wijan Ray from Ohio State University. The study was titled Complications of Stem Cell Tourism in Multiple Sclerosis and Other Neurological Diseases, Results from the First Nationwide Survey of Academic Neurologists. Now, for the purposes of this study, the term stem cell tourism refers to the unethical and sometimes illegal practice of offering unproven stem cell treatment to patients with a variety of neurological conditions, including MS. Unfortunately, for people living with MS and conditions like Parkinson's and ALS, the number of these so-called clinics is increasing. And the fact that researchers are actually experiencing positive outcomes when it comes to their studies involving stem cell therapy makes the false promises that these clinics make seem all the more plausible and likely. People are hearing about stem cell therapy more frequently, they're talking about stem cell therapy more often, and they're bringing their questions to their follow-up appointments with their neurologists. Well, since neurologists working in academic settings have a bit more specialized and informed knowledge of the current state of stem cell therapy, Dr. Ray surveyed academic neurologists about the kinds of things they were hearing from their patients. Just over 200 neurologists from across the country responded to her survey, and here are some of her findings. Well, first, 9 out of 10 neurologists had been asked about stem cell therapy by their patients or their patients' family members, and 2 out of 3 of those neurologists had a patient who had received so-called stem cell therapy. And we're going to call this so-called stem cell therapy because no one actually knows what was being done during these very expensive procedures. 37% of the patients who inquired about stem cell therapy from their neurologist were people who were living with MS. Half of those patients asked their neurologist for permission to undergo one of these treatments. And about a third of the patients, well, they just informed their neurologist that they had already undergone some sort of treatment. Now, among the patients who had undergone some sort of so-called stem cell therapy, 33% had it done in the U.S., 22% traveled to another country, and 37%, well, they reported having a treatment here in the U.S. and a treatment in another country. Those other countries included China, Germany, Mexico, Russia, and Costa Rica. And of the patients who had undergone some sort of so-called stem cell therapy, 1 in 4 experienced complications like MS relapse, like stroke, like sepsis, tumors, hepatitis C, seizures, and even spinal cord injury. And you should know that this high percentage of complications is very different from the percentage of complications being reported in legitimate stem cell clinical trials that are currently taking place. So at the risk of repeating myself here, because I know I've said it frequently, Please pay attention. When you visit a so-called stem cell clinic for some sort of unapproved treatment, you may be facing a 1 in 4 chance of developing serious complications. Some of them, like sepsis, can be life-threatening. In fact, in this survey, 3 neurologists reported having a patient die from complications stemming from these unapproved treatments. Now, the cost of these treatments was reported to be anywhere from $20,000 to $80,000 for each procedure. But at least for some of these patients, the cost was actually much higher. They were the ones who paid with their lives. Dr. Ray's survey labeled stem cell tourism as an emerging public health threat. It called for finding ways to improve the education of MS patients so they don't fall victim to these expensive and dangerous scams. I know how much so many of us want to believe that a cure for MS is at hand. But think about this. If a cure were truly at hand, the news would be blasted from the rooftops. That's not happening today because we're just not there yet. And all I ask is that you think about it and not put your life at risk becoming just one more statistic in another survey just like this one. Given how easily scammers can use social media to make their claims sound like they must be true, it's more important than ever that people living with MS become informed medical consumers. Reviewing the results of this survey could be your first step, and you'll find a link in today's show notes. Pharmaceutical company Celgene has submitted an application to the European Medicines Agency seeking approval for the use of ozanimod to treat relapsing remitting MS within the European Union. And it's expected that by the end of this month, the company will also submit a similar application seeking FDA approval for treating relapsing remitting MS in the United States. Ozanimod is an oral medication that's been developed to treat a number of different immune inflammatory diseases, including relapsing remitting MS, ulcerative colitis, and Crohn's disease. It hasn't been approved for any yet, but 2 large phase 3 clinical trials showed that ozanimod was effective in reducing the relapse rate and the number of brain lesions among patients with relapsing remitting MS when compared to Avonex, which is an injectable treatment. Ozanimod was also shown to significantly reduce brain atrophy, slow disability progression, and promote significant improvements in cognitive processing speed. Well, we'll keep you posted as ozanimod makes its way through the regulatory approval process. We've frequently talked about the role of depression in MS. We know that about 50% of the people living with MS will be diagnosed with clinical depression, and you've heard me describe depression as an 800-pound gorilla that just stands in the way of so much in life. You might want to think about living with depression as seeing the world through a set of lenses that makes everything seem worse. Someone living with depression might pass up going to a rehab appointment or a follow-up appointment with their neurologist. They tend to withdraw socially, and when you're living with MS, you really don't need to be taking any extra steps to increase your feeling of isolation. Some days, someone living with clinical depression might not even want to get out of bed. So, I guess my point is that depression can be a very big deal, and it can get in the way of anyone who's hoping to live their best life while living with MS. Unfortunately, there's a significant percentage of people who are diagnosed with depression who don't seem to respond to the drug treatments that have been available on the market. These people are classified as having treatment-resistant depression. And that's why it's especially good news that the FDA has just approved esketamine nasal spray for treatment-resistant depression. Now, this nasal spray is based on ketamine, which for a long time has been sold illegally as a powerful hallucinogenic club drug called Special K. Well, esketamine offers a lower regulated dosage that can only be administered in a doctor's office. You're not going to have any hallucinogenic effect. But there's still going to be some people who are resistant to esketamine and don't experience any sort of improvement in their mood. But for the people who do experience an improvement, well, they can actually expect to start feeling better sometimes within hours of their first dose of esketamine, and they're only going to need follow-up doses every couple of weeks. And again, all of those doses of esketamine must be administered at a doctor's office. If you happen to be part of the 50% of the people living with MS who are experiencing depression, please be sure to talk to your doctor about treatment. And if you've tried treatment and it hasn't been effective, well, then talk about esketamine. It's the first new treatment for depression in more than a decade, and it offers real hope for living your best life. I'll include a link to the FDA announcement in today's show notes. And while we're talking about treatments that don't seem to work for everyone, as a research scientist, the best way to ensure that any potential treatment for MS is going to be effective is to recruit people that represent the diverse population actually living with MS for your clinical trial. Unfortunately, that doesn't happen very often. My guest today is Dr. Mitzi Joy Williams, and Dr. Williams is a neurologist and MS specialist with a strong interest in better understanding the course of MS in ethnic minority populations and in increasing diversity in clinical research. In a moment, we'll meet my guest, Dr. Mitzi Joy Williams. One of the challenges that's typically faced in clinical trials is trying to recruit minority participation. Yet, if you're hoping to come out of a clinical trial with a treatment that's going to be effective for the diverse population living with multiple sclerosis, well, then having that diversity represented in your clinical trial becomes really important. Dr. Mitzi Joy Williams is a neurologist and MS specialist with a strong interest in better understanding the course of MS in ethnic minority populations and in increasing diversity in clinical research. Dr. Williams is also the author of MS Made Simple, the Essential Guide to Understanding Your Multiple Sclerosis Diagnosis. Welcome to the podcast, Dr. Williams.
Thank you so much for having me, John.
In introducing you, I mentioned that one of your interests is in better understanding the course of MS in ethnic minority populations. So, does that imply that the disease course might be different within minority populations?
So that's a great question, one that we encounter very regularly for those of us who are interested in research. I think the honest answer is we don't really know. So there is a body of research that's really begun to accumulate over the past 10 years that suggests that MS may present differently in ethnic minority populations, including African Americans and people of Hispanic or Latino descent, in terms of the age ranges, also possibly in terms of the symptoms that may occur when this disease presents. And also, there are some studies that suggest the course of disease may be worse, particularly for African Americans. And a couple of different ways that data has been presented include MRIs, which suggest there may be more lesions in African American patients, as well as studies of disability that suggest there may be walking disability that occurs earlier than in their Caucasian counterparts. I think the difficulty with a lot of this data is that much of it is what we call retrospective. So that basically means that we take a group of people and we look backwards to see how they did over time versus looking at data prospectively, which is how many of our clinical trials work. The way that data is collected that way is that we basically start everybody at the same point, put everyone on a pretty level playing field, and then we look forward to see how people do if they're receiving the same care. And so some of the issues with the data that suggests that African Americans may do worse is that we don't have that data where everybody starts on that level playing field. So it's unclear if it is more of a genetic basis or if there may be issues with access to care that may be causing people to do worse, or maybe access to different resources, including a neurologist or an MS specialist. So the honest answer is there are some suggestions that MS is worse, but we really don't know the real answer.
And that really underscores the importance of creating more diverse groups of people to participate in these studies so we can get some of those answers.
Absolutely, absolutely. And so I think it's very important to educate the community at large about the importance of clinical trials and also about how clinical trials and other research studies are conducted. You know, certainly there is a history of discrimination within the healthcare system, and there are numerous real-life examples of that in the history of research here, particularly in the U.S. But clinical trials are done very differently than they were done even 50 or 60 years ago. And there are lots of safeguards in place. There are ethical committees that look at the studies and the protocols. And so there are lots of things in place to make sure that everyone is getting good quality care and that everyone is being treated equally. So I think it's important to educate the community about that and the importance of participation.
Do you have any thoughts on what the best way or some of the best ways might be to do that sort of outreach? Because I agree with you. I think it's so important. How do we make that happen?
So I think there are a couple of different approaches. I think that certainly many people are very engaged in social media. And so I think that provides a medium to gain access and to provide education to a large group of people simultaneously that may not have been able to be reached traditionally with some of our traditional face-to-face programs. I think that also there are opportunities with some of our advocacy groups and other people who are very interested in increasing diversity in research to partner together to provide different educational programs. I know that personally I have done several programs across the country focused on looking at MS and ethnic minority populations. And as a part of that, we also do a lot of discussion around research and the importance of clinical trial participation. I think that there are also opportunities for other organizations, especially ones that are spearheaded by people living with MS to tell us as providers what information is needed to help with education. There are some partnerships with different entities, including myself, other organizations, as well as the Accelerated Cure Project and some members from the I Conquer MS committee to talk about ways to disseminate education for not just people living with MS, but also for healthcare providers, because there certainly could be some issues related to bias on the part of providers who are telling people about research studies. So I think that we have to approach it from both angles, via disseminating education through electronic or video means, as well as in-person education, and partnering together not just with researchers and scientists and with companies, but also with those who are personally affected by MS to make sure that we're providing education that is useful and providing the information that's needed.
You know, moving from clinical research to clinical treatment, I've often heard other researchers say that cultural differences within some ethnic minority populations can often delay when or even how someone who's a member of one of those populations might seek treatment for any chronic condition, including MS. Has that been your observation as well?
Absolutely. And of course, each individual is different, but certainly there are some trends that I've seen in certain populations. I deal primarily with a very large African American population in Atlanta, which is where my practice is based and where I live. And so very often treatment decisions are family decisions. And so there have been instances where a person has come in, we've talked about different treatment options, and maybe they went home, talked to a family member or a group of family members, and the people that they confer with don't think that's a good idea. And that may delay treatment, especially if those members who are particularly involved in care cannot attend a doctor's appointment and kind of go over the data and things like that. I think another barrier or potential barrier sometimes may be religious practices, although oftentimes people pray in conjunction with going to the physician. Sometimes people also look at treatment of a disease as admission to having a disease, and they want to not claims, so to speak, is one of the terms that's used, certain disease processes, and that may also delay treatment. And so I think it's very important for us as healthcare providers to make sure that we try to understand the different barriers or different, aspects that lead someone to start treatment and help lead to their treatment decisions, and that we certainly don't downplay or disregard those ideas, but to make sure we're trying to incorporate those into the treatment plan to make sure that people understand the importance of treatment, and that, everyone's on the same page for treatment goals.
Well, I want to congratulate you on the publication of your new book. It's called MS Made Simple, The Essential Guide to Understanding Your Multiple Sclerosis Diagnosis. Well, what can you tell us about the book?
Thank you so much. So it has been a great feat of mine. I've always wanted to write, and I am really grateful for this opportunity that I've had to publish this book. The goal of the book really is to give people an overview of MS and also to talk about a couple of topics that are very near and dear to my heart, some of which we've discussed today, including MS in the African American community, as well as diversity in research and the importance of clinical research participation. I found that when I diagnose people with MS, or when they first come to see me, there aren't very many comprehensive resources that give people a general overview of MS. I find that either some of the information is very simplistic or much of the information is very spread out. So people have to go to multiple different websites to learn about different things or different aspects of the disease. Or sometimes if they order a book and the book is very thick, they may get overwhelmed and they may just not read the information. And so my goal was to try to explain things in very general terms, in layman's terms, so to speak, so that people who are initially diagnosed could receive that information as well as their family members, because as we discussed earlier, people's family members, their care partners, their support partners are often helping take care of them and helping to make sure that they're taking the best care of their MS, but may not be able to make those doctor's visits and get all of the information. And so it's really intended as a resource for people who are diagnosed, as well as their family members and loved ones, to just get a general overview and also, as I said, to touch on some of those other topics that are not discussed very commonly in most comprehensive MS resources.
I couldn't agree with you more. I know that when someone is diagnosed with MS, there's almost an understandable immediate impulse to just find out as much as you can. And as soon as you jump online, that can get pretty overwhelming pretty quickly. At the same time, I think we've all learned by now that you can't always take the information that you find online at face value, right? Some of it might not be as credible as we'd like it to be. And the last thing anyone needs is to read something online and the next thing you know, they're visiting a so-called clinic in some other country for some kind of unproven procedure, or maybe adopting some kind of special diet because he read somewhere that it's going to cure MS. I think it's so important that there's a book written by a qualified expert that's going to help people really understand MS. So thank you so much for doing that. Tell us, where can people find your book?
Absolutely. So you can find my book. A physical copy of the book can be purchased at www.msmadesimple. So the title of the book, msmadesimple.com. And there you can purchase a copy of the book. Also, there are the ebook and the physical book is available on Amazon as well. And hopefully we'll have an audio book in the next week or so. So I was just finishing up the audio book. But the physical copy, which you would get an autographed copy from me, is at www.msmadesimple. And then also the ebook and physical book to be purchased on Amazon.
Oh, that's great. I would love to see, a lot of neurology offices stocking a quantity of these books and having them on hand for that initial diagnosis visit. I couldn't imagine a better resource to put in somebody's hands as they're leaving the office.
Thank you so much. That will be great. And really the goal is to give people a basic overview, and then they can build on that knowledge because, as people living with MS, as well as family members and support partners, it's a lifelong learning process. We as scientists are learning more information every day. But you need that essential building block to start with. And so it's really just meant to be that building block, and then other knowledge can be added on top of that. So I'm really excited to offer it, and I hope that it is helpful to those who read it and those who give it to their family members or friends.
Well, aside from your clinical work, your research, and the new book, what's next?
Oh, wow. I've got so much going on. So, I have certainly many research projects. So there is a lot of great work that I've been fortunate enough to participate in with many different organizations, including I Conquer MS and the Accelerated Cure Project. So I've got several projects that I'm working on with diversity and clinical research related to those groups. Also, I'm working hopefully to start a registry for African Americans with myself and a couple of my colleagues. So hopefully that will roll out by the end of the year. And I've got various research projects. And on top of that, I got a new position. I accepted a faculty position at my alma mater, Morehouse School of Medicine. So I'll be going back there to work as a faculty member, seeing patients and doing some teaching and research a little later on in the summer. So lots of exciting things on the horizon. And I'm very excited to be able to help those people that I serve on a daily basis.
Well, congratulations on the new position. And as that registry for African Americans living with MS, as that comes online, I want to have an opportunity to talk with you again so we can make sure a lot of our listeners hear about it and can talk about it and understand what it is and why it's so important.
Absolutely. It will be my pleasure to come back, and I will make sure that I keep everyone abreast when we're ready to start enrolling, which hopefully will be in the next couple of months.
Well, Dr. Mitzi Joy Williams, I appreciate all that you do for people living with MS, and especially those who may be in underserved populations. And thanks for talking with me today.
Absolutely. Thank you so much for having me, John.
Well, that's going to wrap up this episode of Real Talk MS. Just a reminder that your feedback, your questions, and suggestions for future podcast episodes are important to me. That's why, in addition to emailing me at john@realtalkms.com, that's JON@realtalkms.com, you can also call the special listener hotline that I set up specifically to capture your comments and suggestions. Just call area code 310-526-2283 in the United States and share your thoughts. So whether you choose to shoot me an email or make a phone call, I hope you'll get in touch and join our conversation. I'm John Strum. Thanks for listening, and we'll catch you next time.